Hi, I'm Dr. Ramsey, and we're going to interrupt the supplement series again, mainly because of current events. 3 weeks ago, on October 17th, on PBS, was an entire show about menopause and how important it is to recognize menopause and treat menopause for a lot of conditions. They were writing a lot of conditions. So I took some notes. I'm only halfway through it, but I wanted to give you the link so you can start listening to it as well. But it's so exciting because now my work that has been considered, very different than anywhere else is now being embraced by the world because these women are saying that the tolerable are becoming intolerable. They're not going to accept their symptoms. And the big one they were talking about was brain fog. There's a neurologist that talks on here about how important estrogen is to the brain. It's the fuel of the brain. And then apparently, and I learned this on this show, that the president signed a $12 billion research project for women's health recently. I don't know when that was, but that means that they're going to start looking at the aspects of menopause instead of miscarriages and other problems, right? They're seeing that menopause is a problem if we don't support it. So women are demanding solutions when women are driving the conversation. And it is well known in the literature that estrogen replacement therapy with bioidentical estradiol does not increase the risk of breast cancer in any study to date. We also know, and they talk a lot about it in this show, is that big study that we've talked about many times that came out in 2002 called the WHI, the Women's Health Initiative. And I'll remind you about this, but this is all pushing off of that because this was now 22 years ago when this study came out, and I happened to be teaching that night about this study, which is really interesting. It was a Premarin arm, so that's synthetic estrogen, and then there was a placebo, so these women didn't take anything. And then the other arm was Prem Pro. So we know that women who have a uterus have to make sure they have enough progesterone to prevent uterine cancer. The arm of the study that was canceled was the Prem Pro arm. But when the Premarin went on, and the reason it was canceled is because the risks outweighed the benefits for everything and was still halted at 5.4 years. And now the Premarin arm went on longer with the placebo showing benefits with heart disease, benefits with lower risks of breast cancer, even the synthetic estrogen, lower risks of breast cancer, just like bioidentical estradiol. So women are demanding solutions. Um, we know that estrogen is safe. Taking estradiol is safe. And we also know that not every woman uses hormones in menopause. I know that clearly. And my teacher would always say those women who don't have symptoms of menopause miss out on all the protection, right? We have the symptoms, the hot flashes, the vaginal dryness, the painful intercourse, the anxiety, the weight gain, the insomnia. They talk about all of these things. So far, anyway, I'm only halfway through. They're not talking about prevention, except for the neurologist preventing the brain from declining, from having brain fog, and how much estrogen is required in the brain to be healthy. She also talks about testosterone vasodilating, increasing blood circulation to the brain in women, reducing their risks of Alzheimer's, et cetera. So they really cover a lot. Things I've been teaching you now for 22 years. It's been really fun, and I'm so glad the world is on board because now we can help more women. If you have any questions, let me know, but there's going to be a link that you can hit and you can watch what I watched as well. It's long. I'm taking it in pieces and enjoy. Bye-bye.